Hi everyone, I'm Rachel Herkman and welcome to this week's episode of Hump Day Health. Lately I've been thinking about what it means to call out for help, what it means to be able to have a voice to ask for help. And this comes up fairly frequently in conversations about mental health. I've been thinking about it more as a lifeguard, and with swimming season now, and having more conversations about water safety. And a big part of being a lifeguard is understanding what someone looks like who's struggling, what it means to be pulled under, what it means for them, what it means for their body, what it means for the people around them who want to help them and make sure that they get to safety. And as lifeguards, we're looking at a few different categories of swimmers who need help. There's something called a distressed swimmer, we have an active drowning victim, and we have a passive drowning victim. When someone is a distressed swimmer, their head is above water, they usually can call out for help, wave for help, we want to get them a rescue tube, pull them to safety. Once someone is an active drowning victim, we're jumping into the pool, and the person is usually flailing or bopping up and down, and they're not able to call out for help because they're so focused on just trying to breathe, so they're not able to. And the next category of passive drowning victim, this is someone where we're not seeing movement, and it's a much more frightening scenario. We want to safely get them out of the water and get them the help that they need, revive them, whatever we have to do. And when I think about the principles of water safety and what's important, I see a lot of parallels with mental health and our emotional experiences. And first of all, with drowning, anyone can drown. You could be a really strong swimmer and you could still drown. Everyone is vulnerable to these types of accidents and challenges when it comes to water. And the next piece is that drowning doesn't always look dramatic. It could be very subtle, it could be very gradual, it's not always rapid decline. It could happen right in front of people who know and care about you. It could happen right there. So it could be subtle too, it could be dramatic. And then the last piece is that when someone is drowning, as it progresses, their ability to call out for help becomes incapacitated. And so when I think about mental health, number one, anyone can struggle with mental health. Mental illness is everywhere. It's in every community, every culture, every age group. I would argue it's on every family tree. It's not a moral issue. It's part of our world, it's part of our community. And you could be a really, really strong person and also struggle with mental illness. That's number one. Number two is that the signs of mental illness and mental health difficulties, sometimes it can be traumatic, but sometimes it could be a lot more subtle, and it doesn't have to be a very rapid decline. It could be a more subtle change as well. And then the third piece is that there are some people that as their mental health and their mental illness deteriorates, it could be more and more difficult, if not impossible, for them to actually voice the need for help because they're just trying to breathe, they're just trying to stay alive. And when I think about these ideas and I think about mental health and I think about what it means in our communities, so one of the challenges is that whereas we can jump into a pool to pull someone to safety, sometimes it's harder to get someone help who's having mental health challenges, who may not want to be helped, or they're telling you that they don't want to be helped. And it's actually interesting because as a lifeguard, one of the interventions that we have is what to do if we swim over to a victim who pulls us under. Right? We get to them and they kind of pull us under too, and how to twist ourselves out of that. And when that happens, it's not that the drowning victim is trying to be aggressive or they're not being rational, they're not rejecting help per se, but they are in a panicked mode, and so they are just grabbing onto whatever they can to try to manage. And I think sometimes that happens when people are trying to get someone close to them help as well, is that they feel like the person is rejecting them and kind of pushing them away, or maybe pulling them under too, who knows. But a lot of it is also just the state that they're in. And it's obviously a much longer conversation about how do we navigate situations where we're trying to get help for someone who may not be open to it. But in any event, these conversations about mental health are so important in terms of understanding that yes, it could be dramatic, but it also could be subtle. And the more we talk about it and the more we normalize the fact that you could be a really, really strong person and also struggle with mental illness, and it doesn't mean that you're bad or immoral or whatever it is. And so many stereotypes that come up for people of what someone looks like who has mental illness and what someone looks like who has a certain diagnosis. And so many times the reality is the opposite or defies that. And the more we have those stereotypes, the less people get help, because it doesn't seem like it's just like that. So hope we can continue having these conversations and pushing the envelope on talking about mental health and the signs of it and the subtleties, getting to know how it feels inside of us when we feel distressed, what people close to us, how they look when they're distressed, and being able to create more community conversations around this. So with that, I wish you guys a great week. Be safe with water safety, and I'll see you guys next week.